the thousands of patients that we have, about 1/3 are patients with special needs. Autism, ADHD, Down syndrome, things of that type. Those patients in that class or their caregivers or families would be very anxious to have dental care just like all other patients and citizens would like to have. And in some cases the patients themselves would really like to cooperate for that, but they just can't. They just don't have the ability to do that. And general anesthesia provides that.
As a parent and as a person interested in science, I'm terribly relieved, and I realized that perhaps a few years ago all this would have been impossible. And his teeth would have deteriorated, adding to some of the handicaps he has.
There's really no other practical way for them to be treated for the things that they need dentally. And there are very few places like this where we can actually treat them successfully with, quality dentistry.
The issue was to get the doctor who had done the handicapped kids the most, and you were not going to find that in a hospital. And the doctor who had the backup equipment, so that as long as he had backup equipment, if there was a problem, then I wanted the doctor who knew the most about handicapped children. So not only did he find anesthesia, first he made sure he was comfortable. He gave Maddie the time to be comfortable. He provided a comfortable environment. He was ready to be flexible to deal with any of his problems. He didn't rush him. He just understood the type of time and accommodation you need to have to deal with handicapped children. Second thing was medically. He understood medically the things that would be good for him for anesthesia and the things that wouldn't, so much so to the point where my son was in a hospital for any other procedure that needed anesthesia, we would get these records and fax them over to the hospital, because the hospital anesthesiologist didn't really want to deal with this or know how to deal with this, and they were very grateful for some record of successful treatment.